This is Dr. Manny Alvarez. I'm with Kidney Consultants of El Paso, Texas. I'd like to talk to you today about hypertension in patients who have chronic kidney disease and hypertension. Hypertension is second only to smoking as a risk factor for death and disability. It is also a leading cause of cardiovascular death and disability worldwide. If a person is free of hypertension at the age of 55, there's a 90% chance of lifetime risk of developing hypertension. Only 50% of the U.S. population achieve a blood pressure of less than 140/90 millimeters of mercury. The consequences of sustained high blood pressure over the years have caused significant amount of problems to those who have acute or chronic kidney diseases due to hypertension. Some of those problems may exist in the eyes, and it affects the brain, can hurt the heart, and also affect the kidneys. Some of the blood pressure measurements that need to be thought about is that what is considered normal blood pressure? Well, normal blood pressure is less than 120/80 millimeters of mercury. When you have an elevated blood pressure, we consider the age along with the blood pressure. If you're below the age of 80, normal blood pressure should be 120/130 systolic, the top number, and the bottom number is 60/85. While if you're over the age of 80, blood pressure is a little bit higher. It usually is 130/140 systolic, and the bottom number is 60/85. What's considered elevated blood pressure in some people may not be elevated in others. If you have stage 1 elevated blood pressure, it's considered, if you have a blood pressure of 130/139, the top number, which is systolic number, and the bottom number 80/89. What is white coat syndrome? Some people, when they go to a doctor's office, develop white coat syndrome. Well, it really is that your blood pressure is normal at home, but when you come to the doctor, you're maybe a little bit anxious and the blood pressure will go up. The doctor will then ask you what your normal blood pressure is at home. And if your blood pressure is normal at home, but yet high at the office, that's what's considered white coat syndrome. What are some of the diagnoses, or how can you make a diagnosis of hypertension? Well, when you go to the doctor's office, the doctor will, for the first time, get a complete history and do a physical. The history to determine if there is any family-associated hypertensive conditions in your family. History will examine the heart and make sure that there's no problems with the heart, the liver, or the lungs, or the kidneys. Also, when we do blood tests, this is important because blood tests will determine whether you have kidney disease due to hypertension. Some of the lab studies that we do get may include everything from a CMP, which will check your creatinine, which will check also your sodium, potassium, chloride, and more importantly, the estimated GFR, which is the blood flow rate that goes through the glomerulus. We also will check a CBC, and also, more importantly, a urinalysis. And urinalysis is important because it'll help us determine whether you contain or have protein in the urine. Also, what are some of the medications that people need to take if they do have hypertension? Usually we start with a thiazide diuretic, but then we'll also have a ACE inhibitor, which is angiotensin receptor, or an angiotensin receptor blocker that we can use. Calcium channel blockers are also very important and are very good medications as well. For the non-black population, this also includes the same medications I just mentioned that if you have diabetes. Combination therapy is also acceptable, and you may be using 2 or more blood pressure medications in order to help control your blood pressure. What is considered primary hypertension? Well, how do we treat something that's considered primary hypertension? Well, obviously your blood pressure is elevated. So one of the things that we really need to do at the beginning is control your blood pressure with lifestyle modifications. Well, what are lifestyle modifications? One of those things may be weight loss, or maybe a diet that's low in sodium, and also we continue to get you to lose weight. What is the exact weight that we really want to get you down to? We'd like to keep you down to a BMI, basic metabolic index, that is less than 25. Correction, let me go back to that. That has to be with a BMI of less than 25. BMI is basic metabolic index. We also need to continue to try to keep your sodium levels low. The amount of sodium that you should be using is anywhere from 1,500 to 2,000 milligrams of sodium per 24 hours. We also will need to follow a DASH diet. DASH diet includes fruits and vegetables and low-fat diet, and also a low-sodium diet. We also want you to eat high potassium, magnesium, and calcium within your diet. We also need to have you reduce your alcohol intake and also exercise at least 30 minutes a day. You can spread out the exercise for 15 minutes in the morning and 15 minutes in the afternoon, but you should do your exercise at least 30 minutes per day, Monday through Friday. What are some of the medications that you can use to control your blood pressure? As we mentioned, the initial medication would be a thiazide diuretic, such as hydrochlorothiazide or chlorothalidone. You can also use what's called an ACE inhibitor, and that includes captopril, lisinopril, and benensopril. Some of the other medications that you can use are angiotensin receptor blockers, such as candesartan, losartan, and valsartan. Also, we can use calcium channel blockers. We can use amlodipine, nifedipine, diltiazem, and verapamil. Another medication that is probably down the list of medications would be a beta blocker, such as atenolol, metoprolol tartrate, and metoprolol succinate, as well as labetalol. We spoke about the white coat syndrome. That's again indicates that where your blood pressure is high in the office, but usually the blood pressure at home is under very good control. We need to make sure that your blood pressure monitor is also working well to make sure that we are getting accurate reading at home. What is the specific population that we're concerned with? In women, usually we use the same medications as we do in men, except for women. For childbearing age group, we have to be careful to avoid the ACE inhibitors or ARBs, not to be used in pregnancies. Diabetic individuals, non-blacks, we like to consider using thiazide diuretics, ACE inhibitors, or ARBs. Whereas in black population with diabetes, we would like to use a thiazide diuretic or a calcium channel blocker. Other age groups that are older individuals over the age of 65, the blood pressure usually increases with age, and we need to make sure that we keep their blood pressures somewhere between 130 to 140, the top number, that's systolic blood pressure. In non-blacks with chronic kidney disease, we will consider using thiazides, calcium channel blockers, or ACE inhibitors. That probably concludes my discussion regarding hypertension. If you have any questions regarding other issues in renal patients, or if you have a problem with kidney disease, call our office in El Paso, Kidney Consultants of El Paso, area code 915-544-7767. We're always available to accept new patients. Thank you very much.